menghadirkan tamu internasional dari Italia dan dari Jerman. Oke, mungkin kita sudah siap untuk langsung mengundang pembicara pertama ya. Untuk OSI, Dr. Carla sudah bergabung bersama dengan di main room. Apakah kita yang membacakan CV Dr. Carla terlebih dahulu saja? Oke, Dr. Carla, Dr. Carla Raimonda Lexas Marcira, spesialis kedokteran jiwa konsultan. Beliau akan menjadi pembicara kita pada hari ini, pembicara pertama. Beliau sekarang ini aktif ya menjadi dosen di Fakultas Kedokteran Universitas Gadjah Mada dan juga praktek sebagai psikiater atau dokter spesialis kedokteran jiwa di RSUP Dr. Sarjito dan beberapa rumah sakit lain. Beliau menempuh pendidikan dokter S1, profesi spesialis dan juga S3-nya, doktornya di Universitas Gadjah Mada. Dan untuk konsultannya Dr. Carla mengambil konsultan psikiatri komunitas juga ya di Universitas Gadjah Mada. Begitu banyak ya proyek-proyek penelitian dan juga penghargaan serta training yang diikutin oleh Dr. Carla baik dalam negeri ataupun luar negeri. Sungguh sangat banyak ya jika dibacakan satu persatu. Mungkin kita langsung saja undang pembicara pertama kita, Dr. Carla. Apakah sudah membersamai kami?
Halo. Halo Nadia.
Apa kabar dokter?
Baik, suara saya terdengar jelas ya? Terdengar ya?
Terdengar dokter, jelas.
Baiklah. Takutnya nanti tidak terdengar, nanti kayak Charlie Chaplin.
Enggak kok dokter, sudah terdengar jelas, kameranya juga sudah sangat jelas. Nampaknya kita sudah sangat siap nih dok untuk mendengar materi dari dokter. Mungkin boleh ditampilkan juga materinya Dr. Carla.
Saya minta tolong ya, karena memang materinya kayaknya di-share oleh host ya.
Iya dok.
Baik. Baik, boleh dimulai?
Silakan dokter, waktu dan tempat dipersilakan.
Saya punya waktu 20 menit, tolong diingatkan ya. Ya, saya nanti kalau minta slide dilanjutkan, saya akan bilang lanjut ya sayang ya. Baik, saya diminta untuk membicarakan tentang mental health adaptation and new normal. Tolong slide lanjut. Iya, sebetulnya bencana pandemi ini mungkin bukan yang pertama, namun demikian setiap saat ada pandemi, itu pasti tidak ada yang siap ya. Jadi tahun 1918 ini sudah ada yang namanya Spanyol atau Spanish Influenza Pandemic. Nah, ini bisa dilihat ya, kayaknya kok maskernya malah lebih gaya ya daripada masker yang sekarang ya, dengan topi dan lain-lain. Dan ini ternyata juga banyak sebetulnya korban-korban ya, jadi yang meninggal karena flu Spanyol ini. Lanjut. Jadi tidak ada ya satu negara pun ya ini yang siap ya, bahkan ada yang mengatakan wah ini bisa berakhirnya beberapa tahun lagi, ada yang mengatakan ini nggak bisa berakhir ini karena tidak ada yang siap. Sampai sekarang kita juga masih mencari vaksinasi dan lain-lain. Jadi kalau dilihat ini sejak Januari sampai dengan sekarang sudah 6 bulan ya, ini ternyata petanya merah semua sekarang. Tidak ada satupun negara yang bisa mencegah terjadinya pandemi COVID-19 di areanya masing-masing. Slide, lanjut. Nah, ini dari penelitiannya Persatuan Dokter Spesialis Kedokteran Jiwa ya. Ini ternyata memang yang paling banyak adalah depresi dan cemas ya. Jadi bisa dilihat ini angkanya itu lebih dari 50%. 63% cemas, 66% depresi diakibatkan oleh COVID-19 ini. Jadi kalau kita bisa lihat ternyata ini dampaknya luar biasa ya bagi kita semuanya. Lanjut. Ini juga ada yang meneliti juga ini ya, kita juga mendapatkan bahwa ternyata apa? Ini ada gejala stres pasca trauma yang menonjol. Karena apa? Karena ternyata memang semuanya merasakan seperti terasing karena nggak boleh keluar atau keluar dengan rasa was-was ya, takut nanti ketularan, takut nanti ada apa-apa, atau misalnya nanti kalau ketemu orang yang OTG bagaimana ya. Dan juga ada yang mengatakan bahwa kok rasanya seperti alert terus, waspada terus, deg-degan terus. Ini gimana ya cara istilahnya menghindari itu semua. Jadi memang sepertinya pandemik ini dalam hal kesehatan jiwa sangat-sangat berdampak luar biasa. Lanjut. Nah ini mungkin gojekannya kita ya, tapi kenyataannya memang demikian. Bahkan yang di dalam rumah pun ini sampai ada yang bergelantungan supaya nggak deket-deketan misalnya. Sudah pakai masker, sudah harus physical distancing, belum nanti kalau istilahnya satu rumah tiba-tiba dikatakan positif, yang lainnya langsung pasti di tracing dan lain sebagainya. Jadi kelihatannya memang susah ya untuk di rumah pun bersama-sama, padahal misalnya kayak kemarin saja Bu Carla misalnya ada tukang yang mau pasang lemari dan lain sebagainya, Bu Carla udah langsung cepat-cepat bawa masker, kemudian kalau bisa ngomongnya jauh-jauhan. Jadi lucu sekali karena seperti di dalam rumah pun seperti tidak terlalu aman. Lanjut. Nah ini ya gojek-gojekannya lagi, kenapa sih di Amerika kok lebih banyak ya angkanya COVID dibandingkan saya di Jepang. Coba lihat itu, karena superhero-nya aja pakai maskernya keliru ya, cuma di matanya doang. Sedangkan yang Jepang-Jepang ini istilahnya menutupi wajah, pokoknya mulut sama hidung semuanya tertutup dengan baik. Kira-kira demikian. Tapi itu cuma gojek-gojekan kita. Lanjut. Ini masih sama ya, aduh, mengisolasi diri, jadi mengisolasi anaknya. Si bapaknya kerja karena diganggu-ganggu terus, karena work from home, dadah semuanya ya, studi from home, work from home. Ini sebetulnya adik-adik kalau ada yang mau meneliti, ini sekarang orang tua pada burn out loh, karena apa? Setiap kali ditanya, ini matematikanya gimana, gurunya kurang jelas menjelasinnya, ini nanti akhirnya yang teriak-teriak ibunya, ini gimana sih, saya sudah harus nyuci, harus nyetrika, ditanya tentang macam-macam matematika, aduh udah jauh banget ya. Kemudian juga kalau dulu mungkin anak-anak kan nggak boleh ya bawa gadget ya, nah sekarang malah belajarnya harus pakai gadget, belum nanti pulsa. Saya tuh kemarin bukan apa-apa ya, lumayan anak saya dapat pulsa 25.000. Saya nanya sama anak saya, Dede itu kalau pulsa yang misalnya kayak dikasih mama gitu sih 100.000 habis berapa lama dek? Alah paling 3 hari habis mas. Saya bilang gitu. Terus 25.000 berapa jam? Saya bilang gitu. Dia cuma ketawa ke TV nggak jelas gitu ya. Lanjut. Nah ini dahulu kala setiap kali ada sakit ya, kita tuh apa-apa aja, akhirnya apa obatnya? Entah itu balsam, entah itu minyak kayu putih, pokoknya pusing masuk angin, kemudian pegel-pegel masuk angin, capek masuk angin juga, kemudian keringat dingin masuk angin juga. Nah ini kesannya kan pokoknya beres dengan balsam atau lain sebagainya. Nah, sekarang itu justru sebaliknya. Lanjut. Kalau adik-adik lihat, ternyata memang COVID-19 ini luar biasa. Sekarang masuk angin langsung kalah dengan adanya COVID. Saya masih ingat sekali punya pasien, meskipun bukanlah psikiater ya, tapi takutnya luar biasa. Kemarin itu ada pasien yang dulu itu memang kena klaster yang satu supermarket gitu yang gede ya, dan Magelang udah pernah tahu semua deh. Nanti kalau saya sebutin nanti segera saya promosi. Kemudian dia sudah diperiksa negatif, tapi setiap kali udah diperiksa segala macam, dia masih ketakutannya luar biasa. Dan saat itu ke tempatnya Bukala tuh tidak bisa tidur, kemudian dia juga merasakan cemas, merasakan waspada. Akhirnya saya bilang, Ibu, ini semua merasakan. Jadi kalau sudah diperiksa negatif, Ibu tenang aja. Tapi tetap nggak bisa tidur. Nanti lama-lama bisa deh, saya kasih obat dulu. Nanti kalau ada apa-apa ke tempatnya Bukala. Nah, penyakitnya ganti. Dokter, kalau saya tergantung sama obatnya dokter Carla gimana? Nah, malah tambah lagi. Saya bilang, enggak Bu, nanti kalau misalnya sudah baik, obat ini saya turunkan dosis dan saya hentikan. Setelah beberapa waktu sih sudah lumayan. Tapi bukanlah juga tahu nanti paling beberapa saat lagi nanti bisa datang lagi ya. Jadi memang sekarang ini seperti takut banget ya terkena, kalau saya tuh terinfeksi bagaimana, anak saya juga bagaimana, ini anak-anak di rumah bapak ibunya pusing karena ditanya terus masalah pelajaran, tapi kalau mau masuk sekolah takut terinfeksi. Nah, ini akhirnya juga istilahnya kita juga mulai berpikir bahwa akhir-akhir ini juga banyak terjadi berita-berita kekerasan terhadap anak. Jangan salah, ada kemarin, dan ini fakta, jadi karena dia tidak bisa menerima pelajaran dengan baik, ibunya jengkel, akhirnya dipukul sampai lemas, bapaknya bantuin, anak itu akhirnya meninggal karena dianiaya, dan akhirnya anak tersebut ketahuannya karena anak itu kembar ya, ditanya sama tetangganya, yang satu mana, kok nggak pernah ada yang curiga loh, ini kok ada kuburan masih basah, kuburan siapa? Ternyata adalah seorang anak yang dibunuh oleh orang tuanya karena orang tuanya jengkel, tidak bisa menerangkan bagaimana dia menerima pelajaran tadi, jadi akhirnya gemes sendiri. Nah, ini salah satu dampak ya istilahnya ya. Lanjut. Nah, ini uh, banyak sekali ya berita-berita menakutkan. Ini sampai berantem itu di WA group, karena apa? Kamu tuh mau gak usah posting yang gitu-gitu toh. Yang satunya lagi jawab lagi, kalau nggak mau baca ya udah dihapus aja lah. Malah berantem di WA group. Jadi memang kita harus pandai, harus apa istilahnya, memilah-milah mana ya yang seharusnya saya sampaikan dan mana yang tidak. Atau kalau tidak, bisa saja misalnya kita melihat dulu, ngecek dulu ini hoax apa bukan. Kenapa? Banyak juga yang posting di belakangnya langsung di bawahnya udah dibilang itu hoax masih diposting. Nah, rame lagi. Kalau enggak apa biasanya kalau di WA group, biasanya akhirnya jualan online, apapun dijual ya di era COVID ini, orang takut keluar dan lain sebagainya. Lanjut. Nah, ini nggak pada capek nih ikut webinar. Saya mau ketawa aja tadi ngobrol-ngobrol ya sama panitia ini ya. Bukanlah tuh saking banyak webinar yang ikut, atau kalau bicara sih jelas ya kita melek ya. Tapi kalau ikut tuh biasanya bolosnya kan cuma dimatikan mic, dimatikan ininya kameranya, habis itu ditinggal nyanyi-nyanyi, ditinggal nyetir, ditinggal mandi, ditinggal mana. Bahkan banyak webinar yang saking banyaknya padahal sudah kita tulis, kita jadwal apa lupa, ketinggalan, ketiduran dan lain sebagainya. Ini saya sering juga sebetulnya menyampaikan, kebetulan bukanlah sekarang ketua Persatuan Dokter Spesialis Kedokteran Jiwa di Yogyakarta ya, cabang Jogja ya, saya sudah wanti-wanti kita kalau mau menyelenggarakan jangan tiap minggu, kalau mau menyelenggarakan webinar pokoknya 1 bulan sekali lah, misalnya setiap bulan ada nggak apa-apa, tapi jangan misalnya setiap minggu kita lakukan webinar terus gitu ya, nanti lama-lama bosan, nanti lama-lama capek. Makanya sekarang ada istilah apa ini, intoxication of Clostridium webinarum ya, saking jadi tengkorak nanti itu webinar terus. Lanjut, ini lagi ya, kebetulan karena kemarin meneliti ya bahwa cyberkondria ini ada hubungannya dengan depresi pada mahasiswa kedokteran. Jadi browsing nyari Mbak Google, nyari yang lain-lainnya, lah malah akhirnya apa? Mendiagnosis sendiri, padahal belum tentu kebenarannya, dikasih tahu dokternya malah ngeyel, kemudian juga sudah menerka-nerka, saya pokoknya diagnosisnya ini dokter, saya mau minta resep. Saya pernah bilang gitu. Atau biasanya kalau Bukala nanya, baik datang ke Bukala, ayo sudah browsing ya? Iya dokter, apa cerita gini, saya menderita inilah. Kalau begitu nanti malah stres sendiri, ya. Jadi kalau ini Bukala selalu katakan hati-hati. Nah ini juga ada yang apa ya istilahnya, gejala-gejala tertentu belum sudah dihubungkan dengan gangguan-gangguan yang berat, misalnya terus takut sendiri, akhirnya apa, malah terjadi depresi dan lain sebagainya. Makanya kalau Bukanlah sarankan, adik-adik juga harus mengedukasi, belum tentu loh yang dirasakan itu sesuai dengan apa yang ada di dalam misalnya atau dibaca di internet dan lain sebagainya. Baik, lanjut. Nah ini ya, jadi ini memang sebetulnya ya penelitian ya dari WHO bahwa corona ini bisa menyebabkan berbagai macam isu-isu kesehatan mental, bisa putus asa, kemudian uh, malah jadi harus menjadi seorang survivor, kemudian merasa tidak berdaya, cemas, kemudian merasa tidak aman, dan macam-macam lah ya. Nah, adik-adik bisa baca di sini, ada penarikan sosial. Nah, ini yang juga penting ya, meskipun kok seolah-olah nggak ada hubungannya, ini ada hubungannya banget deh. Jadi keamanan finansial, ya banyak sekali. Bukanlah juga ada beberapa pasien yang seorang pengusaha ini, dokter saya tuh baru aja ngasih ini loh down payment untuk bayar ruko, lah kok covid gitu, saya tuh cemas, ini karyawan saya banyak sekali dan lain sebagainya, belum nanti kalau harus ada karantina, kemudian juga apa ya istilahnya, mengancam kesehatan fisik ya, karena biasanya banyak orang nggak bisa keluar, kemudian akhirnya juga eh, merasa bahwa tidak berdaya, ini kok semuanya badannya sakit, akhirnya lead to mental health. Lanjut, saya hanya mengingatkan saja bahwa stres itu akan memicu keluarnya hormon stres. Adik-adik sudah tahu ya ini apa, HPA aksis ya, hipotalamus, pituitari, kemudian adrenalin. Jadi yang keluar akhirnya apa? Kortisol, apa, hormon yang menyebabkan seseorang merasakan stres luar biasa. Nah, nanti ini lanjut ke slide selanjutnya. Lanjut. Nah, ini high cortisol levels ini bisa menyebabkan banyak hal ya. Jadi menaikkan berat badan, mood swing, kemudian rasa cemas yang meningkat, tidak bisa tidur, kemudian apa ya istilahnya pipis terus, dan juga bisa kena infeksi cepat karena imunitasnya menurun, naiknya tekanan darah. Nah ini cuma salah satu ya, jerawatan, kemudian juga yang lain ya adik-adik bisa lihat sendiri ya, karena nggak akan baca semuanya. Lanjut. Nah ini lebih jelas lagi ya, jadi sebetulnya untuk physical sama mental nih ya, jadi excessive sweating, heartbeat-nya naik, kemudian juga pegel-pegel, sakit kepala, sakit perut, susah tidur atau malah makannya banyak. Ini kalau untuk yang apa? Untuk yang jiwa itu adanya ketakutan, kemudian juga cemas. macam-macam ya, depresi, dan bahkan bisa lead to suicidal ya.
Mohon maaf dokter.
Lanjut.
Waktunya tinggal 4 menit lagi nih dok.
Waduh, banyak banget padahal ya. Atau kita cepetin aja juga nggak apa-apa. Nah, ini sebetulnya saran-saran ya tentang cemas, kemudian di rumah aja, jangan merokok, milah informasi, dan lain sebagainya. Lanjut. Baik. Nah ini sebetulnya mental issues ya, yang ini yang mungkin penting. Ini nanti bisa skip kok. Jadi lanjut. Ini kita sekarang justru tugasnya adalah promotif dan preventif ya. Kalau kuratif dan lain-lain itu kan bisa nanti. Apa sih yang penting? Nah ini, lanjut. Nah ini, jadi adik-adik, ini diminta untuk apa? Jadi mengelola kebijakan dan program kesehatan masyarakat. Adik-adik ini bisa loh jadi edukator istilahnya ya, menginovasi macam-macam. Ini banyak lomba loh sekarang deh. Ayo ikut bikin film untuk edukasi masalah kesehatan mental di era COVID ini ya. Kemudian penelitian, bimbing, komunikasi, dan juga memimpin masyarakat untuk visi-visi kesehatan dan juga mendidik masyarakat. Lanjut. Baik. Nah ini ya. Jadi sebenarnya yang penting justru malah yang ini ya Dek ya. Jadi kalau Bu Carla, bahwa adik-adik ini akan bergerak di masyarakat dengan upaya tadi promotif preventif, pencegahan, pemberdayaan masyarakat, dan lain sebagainya. Nah yang promotif apa? Lanjut. Nah ini ya. Jadi emosi yang positif harus gembira, senang, pikiran yang positif, jangan berpikir yang hoax-hoax ya, nanti malah stres sendiri, hubungan sosial positif. Nah ini yang penting ya, rutin beribadah. Lanjut. Ini juga jadi mengurangi stres, kemudian relaksasi nanti di bawah akan diajarkan pikir positif, hubungan interpersonal yang baik. Nah ini ya, lanjut. Ini adik-adik diharapkan ya untuk yang preventif dan lain sebagainya. Ini saya kira mungkin bisa dibaca aja. Lanjut. Mohon maaf ya ini bukanlah jadi ngebut. Nah ini relaksasi ya. Jadi istilahnya pertama lewat hidung dulu, detik, kemudian dihembuskan lewat mulut 3 detik. Nah ini jadi ditahan dulu bisa, dan ini diulang 5-10 menit. Ini selalu Bukarlah katakan juga untuk pasien-pasien. Nah lanjut nih terakhir nih. Nah kalau pada saat di karantina ngomong sama tembok, ngomong sama tanaman, sama pot dan lain-lain boleh. Tapi kalau temboknya sama tanamannya, sama potnya kok bales jawab, nah nanti itu sudah saatnya konsultasi sama Bu Carla. Gitu ya. Nah yang terakhir nih yang penting banget. Ini penutupnya kok. Terima kasih dan jelas tidak ada kesehatan tanpa kesehatan jiwa. Tetap promosi kesehatan jiwa. Oke, sudah selesai. Nanti yang kebut-kebut kita diskusikan aja deh.
Ya baik dokter. Ini nampaknya pertanyaannya banyak banget nih dok.
Oh ya, nggak apa-apa.
Iya dok. Sebelumnya saya jadi throwback nih dok di waktu masa-masa S1 kalau dengar pasti selalu ada gojekan-gojekan yang lucu-lucu.
Tidak ya.
Ya dokter. Oke, dari materi dokter, sebelumnya saya terima kasih banyak dok untuk pemaparan materinya. Tentunya kami belajar banyak banget nih dok, baik hal-hal yang updated juga mengenai mental health ya dok, yang related to COVID-19. Yang tadi saya highlight mungkin bagi saya sendiri dan juga para participants, ini penting banget nih peran kita sebagai edukator ya dokter ya, promotif dan preventif yang penting sekali kita bisa menjangkau masyarakat mungkin lewat teman-teman kita, komunitas kita, dan sosial media kita ya dokter ya. Jadi merupakan jadi PR tambahan juga nih dok, abis ikut webinar ini langsung dapat insight baru juga. Oke, kita langsung sesi kita jawab ya dok ya.
Ya.
Oke, ini dari pertanyaan pertama dulu dokter. Ini anonim nih dok, kayaknya nggak dikasih tahu penanya. Tapi ada yang mau nanya nih dok, terkadang saat kita tahu nih kalau kita punya riwayat kontak dengan pasien yang positif COVID, nah kita tuh ngerasa jadi psikosomatik. Nah sebenarnya kalau saat kita merasakan itu, kapan kita harus menghubungi pihak kesehatan? Atau gimana caranya supaya kita bisa membedakan apakah kita tuh tertular atau tidak? Mungkin itu dulu dok.
Iya, terima kasih sekali, pertanyaannya bagus banget. Dan ini kemarin kebetulan Bukala juga diminta untuk tulis chapter buku dan pas sekali kapan kita harus berobat gitu ya. Tapi yang pertama dulu, bagaimana kita memastikan bahwa kita itu tertular atau tidak? Itu pasti periksa dulu. Mungkin pertanyaan, kan periksanya mahal dong, gimana dong? Sama, itu terjadi juga dengan residennya Bukarla. Jadi kemarin itu dia dinyatakan reaktif untuk tes rapid. Wah, semua gempar. Terus saya bilang gini, kalian itu nggak diajari kesehatan jiwa apa ya, orang residen jiwa kok malah gempar sendiri, itu kenapa? Saya bilang itu, kalau takut sekarang tes semuanya. Kemudian kalian kalau takut menjadi seorang OTG, nggak apa-apa. Nah terus duitnya dari mana? Lo kan kemarin residen juga dapat duit kok dari Kemenkes. Terus mereka cuma hihihi. Harusnya kalian yang bayar Bukarla tes lo ini, dia bilang gitu. Namun demikian, pertama kita coba tes rapid dulu. Jadi tes rapid sekarang sudah tidak terlalu mahal. Ada salah satu rumah sakit ketentaraan, ini 75.000. Mungkin juga untuk beberapa orang masih istilahnya masih termasuk mahal, tapi sudah lumayan. Kalau dikatakan tidak reaktif, ya sudah, tidak usah takut. Satu itu dipegang dulu. Kemudian kapan ya kita harus misalnya konsultasi sama Bukarla? Kalau kecemasan itu berlangsung terus menerus sudah mengganggu, tadi yang Bukala bilang, mengganggu pola tidur, pola makan, kemudian allergi juga, deg-degan nggak berhenti-berhenti. Tadi sudah dikatakan mungkin Nadia tadi bahwa jangan-jangan ini psikosomatis nih. Nah, kalau psikosomatisnya itu sudah sangat-sangat istilahnya menonjol banget, kemudian tidak hilang-hilang, nah itu sudah saatnya memang untuk berkonsultasi ke dokter untuk dapatkan pendapat yang lebih profesional, karena takutnya emasnya juga sudah terlalu parah. Nanti biasanya kan merasa, maaf ya, ada yang merasa jangan-jangan saya itu mau mati dan lain sebagainya. Nah itu kalau sudah seperti itu juga biasanya terus nanti larinya pasti ke UGD biasanya. Nah sebelum lari ke UGD, sebelum terjadi panik dan lain sebagainya, sebaiknya konsultasi saja dulu. Dan tidak usah malu, tidak usah takut, nanti jangan-jangan saya gila ini. Biasanya begitu. Saya tuh kok cemas terus, saya tuh alert terus, waspada terus. Nanti jangan-jangan saya gangguan jiwa ini, dokter Karla. Tidak, gangguan jiwa kan ada yang ringan juga. Salah satunya adalah cemas tadi. Jadi harapannya dengan tadi kalau tidak bisa diatasi, sudah konsultasi saja. Jangan lupa konsultasi tetap harus pakai masker, boleh pakai face shield juga. Pasiennya Bukarla, paling tidak saya minta mereka pakai masker karena saya sendiri menutupi plastiknya sampai hampir langit-langit. Jadi memang kita juga apa ya istilahnya berjaga-jaga. Itu ya jawabannya ya.
Nggak boleh gengsi ya. Oke, pertanyaan ini dokter. Nah, kalau misalnya kita nih, misalnya khususnya mungkin mahasiswa kedokteran ya dok, rata-rata yang ikut webinar ini, itu tuh ngalamin nih dok, istilahnya kan sekarang kerennya tuh burnout dok, burnout.
Iya.
Dan Terus butuh juga tuh waktu kurang lebih 3 hari supaya kita bisa balik lagi buat produktif. Nah, kalau dari dokter Kak sendiri, ada nggak dok cara-cara nih untuk mencegah burnout? Atau mungkin kalau udah burnout, apa yang harus kita lakukan supaya kita beralih dari kondisi burnout tersebut, dokter?
Iya, ini selalu saya katakan kepada siapapun ya, kalau sudah mengalami burnout, shutdown dulu. Mesin aja bisa rusak ya, apalagi manusia. Jadi kalau memang sudah capek, terus gimana dong dokter Kala, saya harus kerja nih. Kamu mau kerja tapi habis itu ngelosor, atau istirahat sebentar tapi habis itu bisa lebih fresh lagi. Dan bukalah selalu menyarankan, temukanlah sesuatu yang membuat kamu tuh happy, membuat kamu tuh nyaman. Ya, saya tidak bisa menerapkan apa yang saya lakukan pada semua orang. Jadi hobinya bukanlah itu kan koleksi nggak jelas pokoknya. Jadi satu mungkin mengumpulkan barang-barang yang berbau Hello Kitty. Habis itu sekarang tambah yang agak agak nggak jelas lagi, ngumpulin action figure. Kalau enggak nanti teriak-teriak di kamar mandi nyanyi-nyanyi. Nanti loncat-loncat di halaman nggak jelas itu. Tapi itu bikin saya happy. Kalau enggak browsing-browsing barang lucu-lucu dibeli. Kadang iya, kadang enggak. Karena tahu diri lah. Maksudnya emang barang mau ditaruh di mana, emang punya uang gitu ya. Jadi seseorang harus menemukan apa yang membuat dia nyaman. Itu adalah hobi. Yang kedua mungkin bau-bauan juga. Kalau bukanlah misalnya seneng wangi, wangi yang floral misalnya, tapi ada yang suka wangi yang rempah misalnya kayak gitu, itu bisa membangkitkan mood ya. Atau warna misalnya, wah kok ya tadi nggak tak keluarkan, ini baju ke penjahit, habis itu saya minta tolong dibikinin masker yang sama ya. Jadi meskipun pakai masker nggak mati gaya, saya kasihin masker medis, tapi juga saya kasih masker yang sama dengan bajunya gitu ya. Itu bisa membangkitkan mood, visit pasien nanti pakai baju ini ya. Itu tuh bukanlah sendiri loh ya. Jadi kalau sudah burn out, jangan ditambahi. Itu seperti membakar sesuatu terus disiram bensin. Jadi cooling down dulu. Ya tadi Nadia bilang 3 hari, ya jangan 3 hari Nadia, nanti dicari sama Pak RT nanti. Jadi kalau mau apa istilahnya, mau cooling down kita kita tahu lah, kita atur jadwal saja. Kemarin juga misalnya saya sudah tahu jadwal begini, Minggu sama Cimsa, nanti Selasa saya nguji national board misalnya gitu. Tiba-tiba ada jadwal yang lain masuk, saya udah mikir, aduh nggak bisa nih, tapi tetap harus. Akhirnya saya memutuskan saya tetap bantu, tapi habis itu saya harus istirahat dulu. Istirahatnya apa? Merem sebentar. Merem ya nggak harus sehari ya, beberapa jam sudah cukup. Mungkin kira-kira begitu ya jawabannya. Ini udah pada burn out ya kayaknya ya.
Tunggu dok, masih pada
Jangan ya.
semangat.
Semangat.
Masih ada lagi dokter pertanyaannya
Ya.
dok. Yang ketiga nih dok, ada lagi istilah saya juga baru dengar dok, namanya doom surfing atau doom scrolling. Itu kayak tendensi untuk scrolling dan mencari berita-berita buruk tentang COVID. Nah sebenarnya dampak dari doom surfing itu apa ya dok? Sama
Ya, iya.
kita tuh ingin tetap up to date tapi nggak mempengaruhi kesehatan mental kita. Gimana caranya dokter?
Ya jangan surfing yang dum-dum toh yo. Tapi kalau istilah ilmiahnya cyberchondria ya. Habis surfing itu. Tapi ini lebih khusus mungkin kalau doom tadi ya. Jadi nyari berita yang buruk. Padahal sudah tahu orangnya mungkin kalau bukanlah bilang sebenarnya nggak kuatan gitu ya. Saya selalu mengatakan manusia itu memang spesial. Kalau dikasih tahu, biasanya malah apa? Dilanggar. Jadi kalau terus sebenarnya kayak kucing juga ya, curious gitu loh, pengen tahu. Tapi nanti begitu tahu, wah nanti habis itu doom beneran tadi. Jadi kalau saya bolehlah sekali-sekali browsing, tapi jangan tiap hari. Nanti akhirnya malah apa? Malah mengalami tadi mikir terus, malah nggak istilahnya apa ya, jadi orangnya tuh nggak realistis. Mohon maaf ya, banyak pasiennya Bu Carla itu ya sebetulnya kalau mau diistilahkan itu ya doom surfing tadi, baca yang nggak jelas. Kemudian cari informasi itu bukan yang apa ya yang sudah oke atau sudah di apa ya istilahnya itu divalidasi kebenarannya dan lain-lain. Ya itu yang tadi bukanlah cerita baru istilahnya ada yang wah bombastis itu langsung diposting. Nanti di bawahnya ada yang marah, udah tahu itu tuh hoax gitu. Nah, akhirnya malah rame sendiri. Jadi sekarang uh, cobalah cari informasi itu yang memang benar-benar valid. Atau misalnya kalau tidak sekali dua ternyata setelah itu tahu oh, ternyata hoax tuh banyak sekali ya. Sudah tahu kalau saya akan browsing ini saya akan merasa tidak nyaman, lebih baik tidak usah saja. Jadi sarannya kalau seneng dum-dum tadi ya sekali dua kali boleh deh, habis itu jangan deh, nanti dum beneran. Itu ya.
Iya dokter, siap dong. Ini nampaknya pertanyaan terakhir nih dokter. Mengingat
Boleh.
waktu juga. Oke, terutama mahasiswa juga nih dok yang ikut webinar kali ini, kita tuh mungkin lagi jenuh sama belajar dari rumah dok. Kan dan kadang kita meragukan juga nih kualitas mahasiswa atau mahasiswa atau pelajar yang sekolahnya tuh WFH. Karena mungkin nih sekarang nih khususnya mungkin mahasiswa kedokteran yang bilang kayak aduh kayaknya nanti gue lulus jadi dokter ini jadi dokter beneran nggak ya orang gue belajar WFH kayak gitu. Saya kayak gitu dokter. Istilahnya gimana nih dok dari tanggapan dok gimana cara menghadapi stresnya ini? Terima
Iya.
kasih dokter.
Aduh Nadia, ini pertanyaannya bagus ini. Dan sulit sih yang ngejawabnya. Kemarin soalnya baru aja kita bicarakan masalah itu. Dokter itu kan tidak hanya sekedar kognitif ya. Jadi ada psikomotornya, ada efektifnya dalam arti skills juga. Kita tuh sempat bilang, aduh ini anak-anak gimana ya kalau cuma WFH nggak mungkin ya kayak ngajari orang berenang tapi di kasur. Jadi bisa berenang tapi tidak di air. Izin. Assalamualaikum. Sehat
Amin.
berani.
Universal. Terus ini BTW udah masuk belum ya incomingnya? Oke. Oke, jadi abis ini aku izin ganti bahasa ya. Okay, so dear participants of PEP Talk 2020, we still have two amazing speakers remain. I encourage you to have yourself a comfortable seat. Maybe you can grab some snacks and drinks and be able to enjoy the rest of the event with us. We know that this pandemic has spread to almost all parts of the world, and people are required to live with a new life order, which is defined by new normal. And we would love to hear the stories from Adaptasi medical student from European country. Are you guys curious about that? First, I'd like to greet our first speaker, Grace. Can we invite Grace to the main room? Can you hear my voice, Grace?
Yes.
Is it clear?
I'm
Hello,
just in
Grace.
the waiting room right now.
Pardon me?
They moved me to the waiting room. I cannot see you anymore.
Okay, baby OC can help Grace.
Okay, you're back.
Okay. Okay. So, how are you, Grace? Hello?
Can you see me?
Yes, I can. How about
Okay.
you?
Yes.
Okay. Well, even though we are miles apart, but thankfully you are here with us. Thank you so much for being here, Grace. Let me begin by giving you a warm welcome. And we are so glad to have you here today. And I hope you are doing well during this pandemic. And I'd like to introduce myself. You can call me Nadia, and I will be your moderator for this section. And
Okay.
maybe before we start, can we present Grace curriculum vitae first? Okay, so Grace Marchi is our former incoming or exchange student in 2018. Well, it's quite a while, yeah. 2 years ago,
Yeah.
Grace spent the clerkship in surgery department, and a year before that, she has another experience of exchange in Taiwan, and she took plastic and reconstruction surgery. And she graduated 2 months ago and got a degree in medicine and surgery in University of Catania, Italy. Well, I can see that you have a huge interest in surgery field. Am I right, Grace?
Yes, I surely do. I'm very interested in head and neck surgery, and I hope that will be my future.
Head and neck surgery, that's great. And that's a resume of Grace. And
Find any during pandemic. Although, of course, authorities were being very reassuring with the population about the fact that all supermarkets would have continued to work normally. Hand sanitizer is, of course, one of the most requested products, and is still now. Demand and supply has surged enormously for obvious reasons. And fortunately, my country and my population understands the importance, and in fact, you can find hand sanitizer outside every restaurant, outside malls, shops, and everywhere, and it is compulsory to use it still nowadays. We can switch slide. We also went through a baking craze, especially during lockdown. We increased doing what we are very good at doing, which is cooking. And so almost every household started buying yeast and baking bread and baking pizza. And a study shows that bread yeast demand rocketed to 207%. Yeast and flour were the least findable items in the supermarket. And people were just stacking up as a way to spend time at home with their family and just cooking. So this gives an insight on what our habits and our ways of just spending time and having fun is. Next slide. And of course, you may have seen some videos on social media. People started making and playing music instruments and singing on balconies just to make time pass more pleasantly, and also as a better way to share solidarity and strength. So we can pass to the next slide. Yes. Personal experience, I must admit that my habits as a medical student hardly suffered any changes. You will be able to relate. I must say that during lockdown, I didn't really feel the pressure of lockdown and the stress as my colleagues as well. we were forced to study. I still had many subjects and tests to graduate. So not being able to go out at all, I think has helped me in that, and has given me some more time in some sense, because I'm used to working part-time jobs, so that kind of forced me to stay home and study. Move to the next slide. So restrictions easing started on May 4th, with all gathering sites remaining closed, such as schools, universities. We were only able to go and visit relatives or loved ones. We had to present a certificate whenever we were stopped by police or other authorities. We were able to go to parks, essential shop. Masks in enclosed spaces were compulsory and still are to today. On June 5th, so restriction easing started to kind of be introduced every month. Every month we had different openings and loosening up of restrictions. So on June 15th, restaurants were open to public, of course with limitations. We had less seats where to sit, less tables, and international travel was being made available, and limitations such as immunity certifications, and mostly some countries were not possible to visit at all. Transportation started to take up again. Of course, as it is today, there is a limitation in seats that can be occupied, and up to today, before, as for June 15th, it is and finally on July 14th, while schools and universities and clubs and cinemas remained closed, outdoor gatherings were possible, always with 1 meter distance, and international travel was available with even less limitations, say, for everyone who positive, a positive person. World Health Organization and Italian authorities are trying to reduce this time frame for people who have come in contact. Now we don't have any reassurance that less than 2 weeks can be sufficient. We can switch to the next slide. So, while easing lockdown restrictions and during this pandemic, of course, needs some health recommendation, which are still with alcohol and with solutions. Do not avoid any handshaking and any greeting that involves contact. As you may know, World Health Organization released a new way of greeting each other, and which is distance from each other and avoid gatherings. And what was the medical system before this has gone through some change. So before, if you were sick, you can easily go to the hospital or to the screener. Today, if you have flu-like symptoms or were taking from yeah.
Okay, thank you, Grace. And actually, we have gathered some questions from the participants, but we will discuss them later on. We will proceed to the following speaker. I guess Hanke has already joined us, right? Hanke, can you hear me?
I can hear you. Hi.
Okay, is it clear?
Yes, I can. Can you also hear? Nice. Yes, it is.
Okay. Hello, Hanke. How are you?
I'm very good, thank you. How are you?
Okay, so I am Nadia Hanke. I'm the one that will lead the discussion as the moderator. And we just heard the story from Grace, and now it is your turn. Are you ready?
Yes, I am.
Okay, so before we start, we'd like to know you better. Lucy, can you please show us Hanke's curriculum vitae? Okay, all right. Hanke, you come from a famous city, Hanover. It is located in north of Germany, I guess. And Hanke finished his medical doctor in 2016.
Yeah, it's not really that famous, but
okay, I will continue to read your CV. Hanke has several experiences of studying abroad in Colombia, South America, New Zealand, and of course Yogyakarta, Indonesia. Well, Hanke loves to travel. And okay, so I see that we had a common experience as a Leo. So Hanke was a local exchange officer too in his local committee in Germany, and he also engaged to handle Corona pandemic in uh, his school in Hanover. Well, that's a great resume, Hanke. We shall continue to your presentation. And by the way, for the participants, don't forget to drop your questions to the chat box. And Hanke, time is yours. You can start now.
thank you. So I don't see the presentation at the moment. Is it? Ah, yeah, there it is. Perfect. So yes, I'm Hanke Becker from Germany. I'm not finished my studies so far. I'm at my last year in university, and I study at the Medical School of Hanover, the northern part of Germany in Lower Saxony. And yes, next slides first. So first, I would just give you some general data about the Corona pandemic in Germany, how we experience it, how many people got infected, and how it is about the infection rate. Afterwards, I would like to give you some more personal experience about my own time during the pandemic and how I experienced working in a hospital during this time. And the end, I would like to give you some more information about the situation at the moment and the rules the government introduced at the moment, which we are facing and trying to get, to maintain a good health system. So at the moment, I just looked it up last week. We had in a general around 250,000 reported cases of COVID-19 and around 222,000 recoveries so far. The death rate is with 9,400, lower than in a lot of other European countries. As you can see in the graphic below, the Corona pandemic started in March to get bigger in Germany and had his peak in March and April, as there were the most cases reported. Later, the government introduced some laws and the infection rate went down and stayed around 1,000 reported cases, 500 to 1,000 reported cases per day. So with some difference from day to day. Next slide. So in Germany, there is the Robert Koch Institute, which is responsible for pandemics and disease which are important for the whole country. And there's a national pandemic plan which they have. The National Pandemic Plan has 3 different stages, with the Containment Stage as the first one. The Containment Stage was first introduced in February and had the goal to minimize the expansion of clusters and to find out where people were infected and which people could also be infected to test them. The second stage is the protection stage, which was introduced at the 13th of March. The protection stage was followed with some further rules from the 22nd of March with limit of contact and curfews. Schools and kindergarten were closed, and the borders to the countries next to us were closed 2 days later. At the 18th of March, there was a big television speech from our Chancellor Angela Merkel, in which she told us that the situation is quite dangerous at the moment, and that it's important that all people stay to the rules and to wait first to give us some more time, especially the healthcare system, to organize themselves for a bigger pandemic and to get more information about the coronavirus. As you've seen in the graphic before, the infection rate down from April on. So at the 15th of April, Chancellor Angela Merkel gave us a second television speech in which she told us about the fragile intermediate success, so that we already had a big success and that the infection rate went down, but it is not time to get back to a normal life and to stay and to be aware of a second wave of infections. At the 20th of April, first shops reopened and a new normality started. The biggest rules we had so far in Germany, which we still have, is wearing a face mask in all shops, and also the public transport, and to be aware of the distance rules, which are 1.50 meters from other people, as well as group rules that it's not that we are not allowed to meet as many people as we want. First, there was the rule that every person is just allowed to meet one other person out of a different home, and now it is changed to different rules depending on the area where you're living. So in Lower Saxony, where I live, it is 10 to 50 persons depending on the goal why you're meeting. Later in June, there was there have been temporary local outbreaks, especially in the meat processing plants, which so that there were some further rules for them, and it changed the meeting processing plans as the conditions, working conditions were really bad so far in Germany, but so far nobody really cared about them, and now they are getting better. Rising numbers of reported infections in July and August were detected throughout the whole country, and the government had to urge the public again to stay at home and especially to take care of the new normality as wearing face masks, distance rules, and group regulation so far. In general, in Germany we can report a lower fatality rate than a lot of other European countries, which doesn't really mean that the healthcare system in Germany is really better than in other countries. It's more about that in Germany there was a huge number of tests which was performed and a high number of available intensive care beds which were throughout the pandemic, as we stopped our surgery rooms and had some further introductions for doctors for intensive medical care, so that we had the chance to give more intensive medical care beds in all hospitals. In addition, there was a higher proportion of positive cases among young people, and as we all know, the coronavirus doesn't affect young people as much as older people, so that the fatality rate also could have been lower than in other countries. Next, okay. So for the my own experience, I first didn't really realize how big the pandemic was in especially in February. So in February, mostly affected the economic situation, and especially the touristic economic situation in Germany. The pandemic was very people perceived the pandemic very different. So there were a lot of people at the beginning which were very scared of the infection, and also about the financial problems and freedom and democratical problems. So first we could have seen the scared of the people, as a lot of food was sold out, and in the supermarket, especially food cans, pasta and rice, and the supermarket were nearly empty. Later, there were a lot of problems because of the fast changes of laws and rules in Germany. For example, the closure of kindergartens had a big effect for children who had to take care of the children and had to go to work. So at the beginning, there was not really clear how to act in the pandemic, and a lot of people were not really sure which rules are really suitable in this time. As I already told you, medical students had the possibility to do engagement in hospitals, and a lot of other young people also tried to help to reduce the infection rate. So mostly we had the chance to help the nurses in the intensive care units, and to give them a little bit more help for the patients. But in total, I would say that it was more that we just helped the nurses, and that they didn't have so much to do, but our help wasn't as suitable as the work of themselves and the doctors who were working during this pandemic. the intensive care unit. For me, it was a big issue just to learn staying at home for a longer while and don't meeting other people. So I just was in my own flat alone the whole day, and besides that, I really enjoyed just working in hospital during the pandemic, just to meet other peoples and not to be alone the whole day. I also started to do running a lot, as running was the only sport which was more or less allowed still in Germany, as all sport camps were closed. So running and doing walks was alone was the only possibility to get out of home. And as Grace also told before, I think all over Europe we started to cook more, to bake our own bread or pizza, doing our own pasta, and to just spend more time on cooking. Besides that, I think for me it was very interesting new experience to just contact with the family and friends via social media and mobile phones. I had the experience that I was never having so much phone calls than in this time, but it's not the same like when you're directly facing the other people and meeting them in real life. So,
next. I'm sorry. I'm sorry to interrupt you, but your time is 3 minutes left. You shall continue.
Okay. So I just one last slide, which is about the situation at the moment. At the moment, we have around 1,100 new infections, which is more than we had in June with 500 infections per day. The big rules we have so far is wearing a mask in shops and in public transport, and especially the distance rules. I would say that wearing a mask is quite bad in Germany, as most people don't wear them properly. They just put them over their mouth, but the nose is still free. But the distance rules, the German people take a lot of care about the distance rules, so we really maintain at least 1.50 meters from each other in general. The regulations of group events are very different in every state. In Lower Saxony, at the moment, we are allowed to meet 50 people for weddings and for birth, and beside that, 10 people in general. The rules depends on the infection rate, the area. So there are more than 10 infections per 100,000 people per day. The area needs to give more rules. I would say that at the moment it's quite difficult to get tested in some areas, as they don't want to test everyone. And yes, for me, at the moment, we just have online classes, or mostly online classes. There are just some present classes we have so far, and yes, there's also, as in France or Italy, an online Corona warning app, which was introduced at the 16th of June, but not really a lot of people use it, so the effect of this Corona app isn't as big. Since 1 to 2 months, there are coming more and more demonstrations in Germany. So far, we had over 90 demonstrations of extreme right and left, of the extreme right and left wing, which are about which are scared about the democratical situation in Germany, and also about the economical situation, as we lost our gross domestic product about 10% per year, and the people with work increased from 4.8 to 6.1% this year. So that is it so far from my side, and yeah, if you have any questions, you just let me know.
All right, thank you so much, Hanke, for your explanation. We can see the number of the cases in your country has decreased too until today, and of course, there's a big role of safety precaution, and it takes to prevent another way of infection. It takes a lot of cooperation from the citizen and also from the authorities. Well, so now we have both of our foreign speakers here, Grace and Hanke, and we will start the Q&A session. We have received a lot of questions from the participants, and I will read the question for you, and you can tell us your answer right away. Grace and Hanke, can you hear me?
Yes.
Okay. So the first question goes for both of you. Maybe one of you can take turns to answer it. First question. How well are the restrictions enforced in Italy and or in Germany? And what are the consequences of violating the restrictions? How well is it employed? Okay. Can you get the point?
Yeah,
of
okay.
The question?
Okay, I can raise first. So, at the beginning of the pandemic, I feel that people followed rules more, so also the restrictions were more implemented. Throughout the pandemic, and as time went on, I feel that the people have grown to be a little tired of this pandemic and of all the restrictions, and especially in my region, I live in an island, which is Sicily. I feel that people do not respect the restrictions as much as I would like them to. And I also feel that the authorities are not reinforcing them sufficiently. Sometimes, for example, I see police on the street and people walking in big groups without masks, and the police doesn't say anything. So I'm not sure what is going on in the other regions, but I can say that in my region, in my island, it is not as implemented as it was at the beginning of the pandemic, where everyone was pretty scared about what was going on, also because there were many deaths at the time. Now that most of the cases are asymptomatic cases, people are less frightened about it. Yeah.
Okay, thank you, Grace. So now it's Hanke's turn to answer.
We have more or less the same situation in Germany. So at the beginning, people took a lot of care about all rules and even were more restrictive with the rules than they should have been. So at the beginning, a lot of people, for example, bought food from the supermarket just once a week to return to other persons. At the moment, you don't really feel the rules that much anymore. So, like the face mask, which a lot of people don't really wear very well. That's about the most now. Not really that you feel that there's a new normality. It's really a lot of people are meeting each other without any regulations. And I would say that especially in rules are not, the younger people don't take care that much about the rules, as they are not as much as affected or not as scared about the consequences of getting coronavirus than people.
Okay, thank you so much, Grace and Hankel. We proceed to the next question. The next question is, what do you think we can do as medical students to educate the public and decrease public fear? Grace can answer first.
Okay, so as medical students, we have to talk about it a lot. With personally, now I'm working at the medical guard, and sometimes elderly people from very remote areas and maybe are not well informed. About I feel the responsibility to inform them, and it is important to explain in very simple ways, with very simple words, what the regulations are and why some
Stick to some very simple rules and.
Next question. Grace, what do you think your government did successfully in order to ease the population's panic? Well, we are talking about mental health here.
Excuse me, can you repeat the question?
Okay. What do you think your government did successfully in order to ease the population's panic?
Okay. I must say that under a psychological point of view, my government hasn't done anything special. Maybe other governments have introduced maybe a special phone line for people who wanted to speak to a psychologist. My government hasn't done this, but has always tried to recommend in a very reassuring way, has never wanted to put panic in the population. Unfortunately, the opposition in my country has played an important role in fomenting people to be afraid of the new regulations and to be intolerant with the new regulations. I don't think my government has taken any specific decision as for what concerns mental health. I must say this, but there have been made different offers, many different let's say changes have been made as for donations and things like that, but nothing specific for mental health.
Okay, thank you, Grace. And how about Hanke? How about Germany government?
I think for mental health, so far I don't know any project which Germany introduced, so it wasn't really that they gave us any thing to get better with the situation, as you were isolated most of the time. Yeah, so for mental health, it wasn't really clear how to act with this problem, but Germany hasn't done anything for that.
Okay, next question. It goes for you, Grace. The easing restrictions policy that you mentioned before is pretty interesting, but not few people insist universities should be open instead of gyms, and apparently, wait a minute, and Oh, I'm sorry. The questions is not complete. I'm sorry, Grace. Maybe we can continue to the next questions. So, Hanke, so some of the participants here watched a football game last night. I guess he watched football in Europe. And unfortunately, he saw the attendings of the game as not wearing mask. And he wonders how strict is it at the moment to wear masks as well as to follow the safety protocols in Germany.
Sorry, can you just repeat the question once more? The internet connection was really bad and I could understand the whole question.
Okay, that's okay. So the participants here wonders how strict is it at the moment to wear masks as well as to follow the safety protocols in Germany.
To be honest, it's not really strict. So there are these rules to wear face mask in public transport and also in shops, but most shops don't really control it that much, and there are, so far as I know, there are not a lot of fees which are given by the police for not staying to the rules. So it's more that it's your own responsibility to stay to. But a lot of people are not scared of the pandemic anymore.
Thank you, Hanke. So, Grace, I have completed the questions for you. The previous questions was the easy restrictions policy you mentioned before is pretty interesting. Not few people insist universities should be opened instead of gyms. Apparently, this happens in a number of different countries, like the US and even in our country, Indonesia. And what is your opinion on this matter?
I totally agree with this. I think that this was a very big mistake. I think mostly for universities because clubs were open around July and June. Restaurants, gathering places were open. Instead, study rooms or libraries in the universities were closed. And personally, I'm very used to studying in libraries and study rooms as much as my colleagues are. And I think there was no reason to keep these closed when they opened clubs and restaurants and other gathering places. So it was kind of, it didn't make any sense to me and to my fellow medical friends, medical students. So this for sure was not something very reasoned and very smart they did. Of course, schools, it's reasonable that schools remain closed. Schools have just reopened, as a matter of fact, with many controversies and with many new regulations. So we know that kids are not able to maintain distances and behave as much as university students. But I believe that they could have kept universities open since all the other places were open as well as gyms too.
Okay, thank you, Grace. Well, this is the final questions, and it goes to Hanke. What are the concrete steps has the German government taken in the implementation of the protection point in the national pandemic plan?
I think the just once again the biggest laws Germany has introduced, right? What is the question?
The concrete steps that has German government taken in the implementation of protection in the national pandemic plan?
So to be honest, I think Germany was as unclear about the concrete steps in advance as many other countries because we never had a pandemic like this before. So there was this plan from the Robert Koch Institute, but all laws which were introduced during the time so far were just out of guessing what might be suitable at the certain time. So the moment we are trying to get back to a normality where especially the economic situation gets better again by reopening a lot of shop reopening and ending a lot of laws so far, but there's always the scare of a second wave. So at the moment, especially the economic situation is important for Germany to improve again without getting higher infection rates again. But there are not really certain steps, and in Germany there are a lot of different rules in different areas, and most people are not sure which is allowed in their area, as every area can introduce different rules, and that's also a thing which a lot of people complain about the German government, that it's not clear which rules are for which area.
Okay, thank you so much, Hanke. Well, that's the final question, and I think that's all for today. That's quite fascinating discussion. And by the way, similar to what you guys have said, practically our country, Indonesia, starts to ease some restrictions too. But unfortunately, the cases actually went up. And we cannot deny that there are so many flaws that we have in our developing country. And we admit that this lackness couldn't be fixed immediately or at a glance. And it is still a strive for us to always do the social distancing and wear masks and to follow the health protocols. Once more, thank you so much, Hanke and Grace. It really opened our eyes to a new perspective of dealing this pandemic. And that's a wrap up our event. Thank you for making the time to join us here. And we will give the appreciation in the form of certificate. I will give the MC to, the OC. Can you please prepare the certificate, the online certificate? And maybe it would be better to keep documentation. Can we have a picture together, Hanke and Grace?
Sure.
Okay, so OC, can you please take over?
Okay, Kanadia. Maybe I'll take over it. I would like to say thank you for both Grace and Hanke for the time and experience to share with us. We would like to do some speaker, which is the certificate. Maybe for the committee, share the e-certificate to the screen, please. Okay. Okay, so the first certificate is for Grace first. And then all the participants, can we take a photo with Grace first? I will count it for you all. The committee, is the camera ready? Okay. Okay, I'll count it, yeah? 1, 2, 3, smile. Okay. Okay, and then the next one is the certificate for Hanke. Can the committee share the e-certificate to the screen, please? Okay. Okay, I'll count it for the photo session. 1, 2, 3, smile. Okay. Once again, thank you so much for the time, and it's our pleasure to have you all with us. So, and okay, you can leave or stay with us until the end. Baik, teman-teman semua, terima kasih banyak juga kami ucapkan kepada Kanadia Stefani Andika sebagai moderator PEPH Talk 2020 yang telah memimpin jalannya acara webinar ini sehingga dapat berjalan dengan lancar dan baik. Agenda selanjutnya adalah pemberian penghargaan secara simbolik kepada Kanadia dan kita akan berfoto bersama. Untuk panitia, Ausi boleh ditampilkan sertifikat Kanadia di layar. Baik, Kanadia, kita akan foto bersama-sama dulu ya, Kak. Oke, teman-teman semua, boleh di-on-in webcam-nya dan juga panitia semuanya. Aku hitung ya. 1, 2, 3, cheese. Oke, sudah? Baik. Baik, teman-teman, sudah tidak terasa kita hampir sampai di penghujung acara. Namun, sebelum itu, seperti yang sudah saya katakan di awal, bahwa teman-teman wajib untuk mengisi post-test sebagai syarat untuk mendapatkan e-certificate. Post-test ini akan terdiri dari 8 soal yang dikerjakan selama 10 menit. Link Google Form untuk post-test akan dibagikan oleh panitia melalui kolom chat di Zoom. Untuk panitia, boleh diberikan tautannya, baik sudah diberikan tautannya oleh OC_PJ pertanyaan 2. Teman-teman boleh mengerjakan pretest, waktunya adalah, maksud saya mengerjakan post-test, waktunya adalah 10 menit, dimulai dari sekarang. Baik teman-teman semua, sembari mengerjakan post-test, saya ingin menginformasikan bahwa nanti akan diadakan juga online campaign dan juga webinar oleh Scorp Cimsa bisa dicek untuk Instagramnya di IG-nya CIMSA-UGM untuk informasi lebih lanjut. Dan yang pastinya, webinar dan online campaign ini akan sangat menarik. Dan diingatkan kembali untuk post-test, waktunya sampai jam 15.25 ya teman-teman. Masih ada sekitar 9 menit lagi. Dimohon untuk semua partisipan yang hadir di Zoom ini untuk mengerjakan post-test, karena sebagai syarat untuk mendapatkan e-sertifikat. Baik teman-teman, diingatkan kembali waktu pengerjaan pretest sampai 15.25 dan teman-teman dimohon jangan lift terlebih dahulu ya, karena di akhir akan ada sesi dokumentasi yang nantinya akan dibagikan melalui WhatsApp group. Maksud saya untuk post-test sampai 15.25 ya teman-teman. kasih bagi teman-teman yang sudah mengerjakan post-test. Dengan selesainya post-test ini, kita sampai pada penghujung acara webinar PEP Talk 2020. Kami segenap panitia mengucapkan terima kasih bagi para peserta yang telah meluangkan waktu untuk mengikuti serangkaian acara ini, dan juga kami ingin memohon maaf apabila terdapat kesalahan dan ketidaknyamanan, baik yang disengaja maupun tidak. Untuk informasi terkait sertifikat selanjutnya melalui WhatsApp grup yang telah dibuat. Marilah untuk menutup acara pada sore hari ini, marilah kita berdoa menurut agama dan kepercayaan. Doa dimulai. Tidak ada kata cukup dalam berdoa. Baik, sebelum teman-teman leave, alangkah baiknya kita melakukan foto bersama dulu. Untuk teman-teman, dipersilakan untuk menyalakan kamera. Ini aku cekin satu-satu ya, teman-teman. Boleh dulu diposisikan agar terlihat jelas teman-teman semua, yang nantinya dokumentasi ini akan diberikan oleh panitia melalui WhatsApp group. Ini ada 19 slide. Sebentar, saya lihat terlebih dahulu. Oke, ini ada, iya betul, 19 slide, cuman ini banyak yang nggak on kamera. Panitia, apakah kita foto semuanya atau hanya yang on cam aja? Oke, kita mulai ya. Teman-teman panitia, kalau misalkan sudah selesai, boleh diinformasikan. Ada 5 slide, mohon maaf. Oke. Kita mulai dari slide pertama. Ini di slide pertama terlihat OSI semua ya, dan ada beberapa partisipan. Aku hitung sampai 5 ya teman-teman, bukan sampai 3. Oke, ditahan senyumnya. 1, 2, 4, 5. Baik, slide selanjutnya. 1, 2, 3, 4, 5. Slide selanjutnya, 1, 2, 3, 4, 5. Slide selanjutnya, 1, 2, 3, 4,